Welcome to another episode of the Your Longevity Blueprint podcast. Today, my guest is Lourie. There are many ways to look at breast cancer: the metabolic, taking into consideration the pathways that promote cancer; the environmental, how increased exposure to toxins is becoming a greater influence; the emotional, how trauma, either recent or many years prior, contributes. But simply put, a cancer diagnosis is a very loud message that there is a loss of harmony, usually in more than one area of a woman's life. So the task at hand becomes how to restore the harmony, physically, emotionally, and spiritually. Lourie is a naturopath, acupuncturist, homeopath, and holistic breast health expert with more than 35 years experience understanding complex chronic disease. She believes healing is always possible, and her mission is to empower women with the tools needed to deeply recover their health and restore their life. Welcome to the show again, Carol.
Thank you so
I should
much
call
for
you
having
Dr.
me.
Lourie.
No, you can call me Carol. It's fine. Like everybody has enough doctors in their life, so I'm happy to be just Carol.
For those of you who recognize her name, I first had her on the show for season 1, episode 29, where we talked about healthy holiday baking. So she's actually a former pastry chef, as she reminded me before we started recording today. And I encourage you all check out that episode. But I want to bring that up because I want you to share your story, right? How did you go from pastry chef to breast health expert? What has your journey been like?
Well, thank you for having me again. I'm excited and honored to be here. I was always interested in being a doctor, but it took me a while to get there. And before that, I used to cook. So I ended up working in restaurants, working my way through undergraduate school in Philadelphia. And then I had my own catering business. And I was, my grandmother baked. So I used to bake with my mom and my grandmother, and I really began to develop recipes. And Julia Child, I started experimenting with her, and then I just became a pastry chef for a restaurant with regular pastry baking, which is not what I do now. And then I ended up living in New York in a spiritual community and working for this doctor who did detoxifying diets. And
Cool. Yeah.
and this was in the 70s, before the word detox was part of our everyday language. And he had people coming into him who had either been harmed by the medical profession, not helped, or just didn't know what to do. And for example, I remember this one young girl came in with very bad skin, and I had just started working in his office, and I'm thinking in my brain, why is she here? You take antibiotics. You have bad skin, you take antibiotics. Why do you have to do detoxifying and blended salads and all this? And then just in a month, I mean, he must have seen, I don't know, 50 people. Everybody was coming in and everybody was getting better. And then she came in after her return visit 6 weeks later, and she was like this different person. And I began to think, okay, what is going on here? And one day I was cleaning up this huge pile of papers on a desk, and there was this catalog to the National College of Naturopathic Medicine. And I had always intended to apply to regular medical school, but I saw that, and there I was in this environment, and I decided, maybe I should go here. So it was this series of, when you look back in your life, that was many years ago already, this led to this, led to that, and it was meant to be that I attended the National College of Naturopathic Medicine. And then I moved to California and got my acupuncture license. And I am very grateful to have this perspective on healing, because it's all about root causes. And there's not one thing that creates any disease. And it's not about you have symptom A, you take drug B, although sometimes that is very necessary. I'm not an anti-drug person. I'm be smart when you take drugs and always try natural first. So that's how I ended up becoming a regular naturopath. And then a dear friend of mine was diagnosed with breast cancer. And when she called me hysterically crying to tell me they had found a lump, women with breast cancer know those words. I said to her, don't worry, you're not going to be alone. And every single treatment and appointment for 18 months, I went with her to UCSF, and I took care of her afterwards. And it was a rude awakening, because there is this thing called the Warburg effect, which is a well-known scientific fact. The doctor won a Nobel Peace Prize for it. Cancer, given a choice between sugar and oxygen for the cancer gas tank, always chooses sugar, even though it gets much less ATP or energy, and it has to work twice as hard to get it. So we go into UCSF for her infusion, and they say to her, well, you look a little thin. Would you like some Ensure? Which the number one ingredient is glucose. Then they offered her a cupcake, a hard candy, a popsicle, and a cookie.
You're
5
cracking
times.
up. Yeah, exactly. Oh my gosh.
So here we are getting an infusion to supposedly kill cancer, and they're
She's
offering her
being fed
sugar.
sugar. Yeah.
So there's a very big disconnect in the medical oncology world between the concept that cancer is a metabolic disease, which provides women or anyone who has any type of cancer with a lot of empowerment and options over, are you going to feed the cancer gas tank, or are you going to keep it as empty as possible? And I think
like
that's
that.
a wonderful perspective. Yes.
Keep it empty. Yes. That's great. Okay, good story. So let's just dive right in to how does hormone health contribute to reducing risk of breast cancer?
Well, let's just start with this example. When you walked down the grocery aisle in a normal grocery store and you're going to buy laundry detergent or cleaning supplies and you're assaulted with that smell, we have been raised that that smell is healthy.
And
That
clean.
smell, yes, and clean. Every single thing in that aisle is filled with estrogen disruptors, every single item. And that is the beginning. And then there's the body wash and the hair stuff and the creams and the soap, every single thing that Americans use for personal care and in their home, that Glade and the Febreze and the plugins and all of that. So what is an estrogen disruptor? Estrogen metabolism, which is a healthy version of who we are normally, has to be broken down into so it can be eliminated safely and easily from your liver into your intestines and your urine. So, but what happens? You take these chemicals and they get into the parking spot, so to speak, where estrogen normally would go to bind to be eliminated. And so the healthy estrogen goes to park the car to get out of the parking garage. And it goes, what the heck? There's no place for me to be. And then it turns into an unhealthy version of itself. And that leads to estrogen dominance. So that is a very simple explanation of what happens with estrogen metabolism. Now, then we have environmental issues, which also go through the same thing. They need to be detoxified by the liver, phase 1 and phase 2, eliminated through your stool. They can't get out either. So there's this big backlog in your body of toxins that aren't able to be properly and safely eliminated. Your body tries to keep up. It develops endometriosis, polycystic ovarian syndrome, painful periods, acne, infertility. Eventually, it goes, I can't hold back the dam anymore, and you end up with some form of cancer. So
well said. Thank you because this podcast is not really just about breast cancer. I mean, this is really about proper estrogen metabolism and reducing our risks of all those things you mentioned, even endometriosis, which I've struggled with. So thank you for bringing all those up. That was good. Continue.
Thank you. I'm glad that makes sense. I try to take complicated science and make it so that women have images so they can think about, well, am I going to buy this unhealthy laundry detergent? And let me give an example of a story, which is a true story. I had this beautiful 35-year-old woman come into my practice, and she had on enough perfume that it was like the ground floor of Macy's, if anybody has been to a Macy's department store. And I had a scent-free office, so I almost had to send her home and tell her to come back. But I opened up the door. She came in through the side, and I said, so tell me about scent. And she said, oh, I love scents. I said, well, what is it? She said, well, first of all, I have the plug-ins, I have the sticks in the oil, and I spray my sofa with that thing, which is very
Febreze
toxic.
or whatever.
Febreze. And then she has a dog, and the dog jumps up on the sofa, and she pets the dog, and the dog sleeps with her. She used normal laundry detergent and dryer sheets. So you take a shower, you get out of the shower. Yeah, exactly. You get out of the shower, you wrap your body in a towel, and your pores are open, and the dryer sheets, which are AKA estrogen disrupting chemicals, everyone, get sucked into your body, and then you wonder why you can't get pregnant or end up with some endometriosis or breast cancer. And you sleep, and the same thing happens. So I said to her, do me a favor, go home and put every single thing on the counter and take a photo. 29 items, thousands of dollars. And she came in with a diagnosis of unexplained infertility. I said, you don't have unexplained infertility. It's very easy. She was looking at $45,000 of IVF at 35. I said, let's throw everything out. She had to throw out her sofa because we couldn't detoxify it. She took a week off from work, cleaned everything with eco laundry detergent, got rid of all the plugins and everything. And 3 months later, she was pregnant, and she didn't have
Wow.
trouble getting pregnant once we got rid of those estrogen parking spot taker uppers.
What
and
else
we
did you do
cleared
with her?
out.
So
Well,
did
yeah,
you
what
detox
else?
her? Yeah.
Absolutely. She got on, first of all, we cleaned up her diet. She was eating the standard American diet. The standard American diet literally quadruples the cancer rate. That is a PubMed
Wow.
comment.
Yeah.
Quadruples, everyone, not to mention autoimmune disease, cardiovascular, obesity, you name it. The standard American diet is not your friend. So we changed her diet, modified Mediterranean, lots of organic vegetables, little bit of protein. She started, power walking and working out with her husband. She dragged him around. They both lost a lot of weight. I gave her very specific permeability factors, gave her the healing smoothie recipe, which your audience is going to get. I did acupuncture on her, lots of antioxidants, charcoal, detox, the whole thing. 3 months later, saved her $45,000.
Wow.
So
did she have estrogen dominance, like based on hormone
100%.
labs?
Yes,
That was
I
corrected.
did.
Yes. Just to
I did.
clarify. Yeah. Yeah.
Yes, I did the Dutch hormonal panel on her, which you and I had just spoken about. The Dutch hormonal panel is a urine and saliva test. It's a very easy collection. And what it does is it says, is your estrogen being detoxed properly, or do you have too much going in the unhealthy red pathway? It shows it very clearly on the report. And so we did one at the beginning, and then we did one 3 months later, and it was night and day. So that's the beauty of functional medicine. If you know what test to do, and you do a baseline test and you go, this is where the problems are, and then you put people on a protocol, and then you retest and you go, oh, here we are. Everything's cleared up. No more backed up dam of estrogen dominance for her. And her husband was taking supplements, and
he was probably estrogen dominant too.
Oh, how could he not be? Men can be estrogen dominant, and men also get breast cancer, which, as an integrative practitioner, it's not hard to treat men who have had breast cancer. I mean, because they have horrible estrogen dominance, right? And they're toxing their life. So but they're not educated when they go through medical oncology. So then they do that and they come see me, because if you don't do that, then it's going to come back. If you don't change your life,
prostate cancer, colon cancer, or something else. Yep.
Yeah. If you have a diagnosis of breast or any type of cancer, or if you have cancer in your family, you need to realize that there isn't just one thing that creates cancer. It's just a message from your body. Hi, I'm unhealthy and I have these unhealthy pathways. My cells are out of control. It's not that hard to make the changes that are necessary to get your cells to understand that you're the boss and not them. Because very simple, cancer is a disease where the cells have decided to stop paying attention to the rules of stop and go. They just keep going. Then they think they can call over to the neighbors and the town over, and that's called cell signaling, and get everybody to join to make a tumor. You want to interrupt those cell signaling.
Yes.
You want to, it's not that hard, but you need to work with somebody. You don't want to go out and spend thousands of dollars on supplements. You don't know if you need them.
Totally agreed. Yeah.
Yeah. And you do that same thing in your practice. You have the same perspective.
So let's go back to estrogen dominance. So what's the most important thing to do for your health if you think you have estrogen dominance? And maybe define that for the audience too. What does that mean?
Estrogen dominance is when you have a backup in your internal body of being able to break down estrogen in a healthy way. And there are signs in your body, and very clear signs in lab work, that you have estrogen dominance. In your body, you can have acne, you can have very painful periods, you can have like overweight, but it shows up around your middle line. And you can have difficulty losing weight. You could be thin everywhere else, but you have this middle, that you can grab onto abdominal fat. You could starve yourself and still not lose weight.
Yeah. I would add heavy bleeding to that.
Yeah. Painful periods, very heavy bleeding, irregular periods, endometriosis, horrible PMS, polycystic ovarian syndrome. It can run in your family. You can have excess hair on your body, in your face, in your breasts, on your abdomen. Yeah, that's estrogen dominance. So it shows up.
Yes.
right?
And then what's the most important thing to do if we
Well,
have that?
I think to get the Dutch hormonal panel is great. That's the baseline.
Yep.
And then from an integrative standpoint, well, I think there's three things. Sorry, I can't do it one. One is to find
Lay it all on us. That's fine. Yeah.
one is to find an integrative practitioner who knows what they're doing and can do this in their sleep. And it's not hard for them
Yeah.
to say, okay, here's what we have to do. After you do that first test, the Dutch hormonal panel, you need to do it like what this woman did. Get everything that you're using on your body in your house with cleaning products and put everything on the counter and start reading the labels. And if there's a warning sign on them, or if they're made with fragrances, out in the trash can. So that's number one. I think that's because you can't get better if you continue to assault your body with these toxins and chemicals. That's number one.
The same thing with like treating a patient for mold. We always say the first step is removing them from the source of exposure. So if you're estrogen dominant, you can't just continue to expose yourself to estrogen, endocrine disrupting chemicals with estrogenic properties. Totally agree.
Right.
Okay, what's the third thing?
Clean up your diet. You can, well, the first thing was the practitioner. The second thing is removal. The third thing is what you eat. You cannot continue to eat the standard American diet and think you will ever be healthy again.
You preach. You're
The standard American diet is the slippery slope to ending up with some type of disease as you get older. I mean, it's 1 and 1 equals 2.
Yep.
It's not pleasant. It's not pleasant, and it's not our friend.
And changing your diet and removing the chemicals, as you mentioned with this example of your patient, right? It sounds like in a very short period of time for this individual, you can reverse the estrogen dominance and it better influence your estrogen metabolism pathways for the better.
100%.
And many times I'm recommending supplements like DIM and B vitamins and antioxidants and sometimes calcium diglucarate, those sort of things to further help. But like you alluded to earlier, you don't want to just go taking supplements if you don't know you need them. So getting the test will help your provider determine what you do need.
Right. I mean, testing in the long run saves money because you're able to target the supplements better. And sometimes people say, I don't want to do that, in which I'm saying very clearly, okay, I'm going to throw the kitchen sink at you, but that's going to be almost as expensive as taking the test. So, we're raised in America that if it's not going to be covered by insurance, that's out of the box abnormal expense. And my attitude is, if nobody
you pay now or you pay later, that's my
attitude. And also, people don't have any problem spending $300 on an Apple Watch or a new phone or some clothing or whatever. It's like, if you don't have your health, it's like, it doesn't matter what. It's the basis of having energy for your day.
Agreed. Okay, so what do you need to know if you have breast or any other forms of cancer in your family? I feel like these answers could be the same. You could repeat what you just said.
Yeah, no problem. Well, first of all, if you have breast or ovarian cancer, or, there is a relationship between pancreatic cancer and breast cancer.
I didn't quite know that.
Yes, the BRCA2 gene is also in the pancreatic cancer. Yeah. I had my dear friend that I've known since I was 9, her husband had pancreatic cancer. I said to her, make sure he gets that test. And they did. And they have 2 daughters, and they then were tested for the BRCA1 and 2 gene, and they were positive. So that is empowerment.
Yep.
One of them had prophylactic mastectomy.
Wow.
So, because there is an increased risk if your one relative has the BRCA1 and 2 gene of the first generation getting breast cancer, knowledge is power, in my opinion.
Yep.
So, I'm sorry, what do they need to do?
Or what do they need to know?
What do you need to know?
Yeah.
If you have a first line relative in your family, mother, maternal aunt, first cousin who's had breast cancer, you need to have a higher level of diagnostic workup with mammogram and ultrasound. And you need to go to a major teaching hospital and be monitored every 6 months with that at least. But if we dive deeper inside to that, I would start working with someone like myself, as my friend's 2 daughters, to have there are prophylactic things that we can do to keep your estrogen pathways on the healthy side. And
Mhm.
you're a young person, you're in your 30s or 40s, women are getting breast cancer at very earlier age.
I
It's
know.
very alarming. 26, 32, that's young. That's a
It's
long
very
time.
young. Yep.
That's alarmingly young. So first of all, with any woman like that, there's the Dutch hormonal panel, which is the first thing that's done.
Yep.
And then divorcing the standard American diet, adopting a way of eating that is easy and healthy and manageable because you're a young person. I really feel like this way of eating, you can go to any restaurant outside of a pizza place, you can, or a hot dog stand, which nobody should be eating regular hot dogs. You can go anywhere and get healthy food, protein, salad, vegetables. I mean, you don't need to feel deprived. Eat it in a nice Italian restaurant. You can get grilled fish with yummy tomato sauce all over it. I mean, you don't need, or you can ask them to bring your gluten-free pasta and get some, it's a low carb diet and it is gluten-free. So you have to know that, but there's healthy fats, healthy fats are your friend. So I think the advanced testing, working with a genetic counselor at a major hospital is very beneficial. All of that will be covered by your insurance. And then really understanding how what you're eating and your lifestyle and what you have in your home as far as toxic cleaning products contribute to
Sure.
unhealthy pathways.
Do I dare ask about thermography? What your
Oh,
thoughts
yeah,
are on that? I mean, there are
100%.
various types of imaging, and I think they all
Right.
have their strengths and their
Yes.
limitations. So
Yeah.
what are your thoughts on thermography, specifically
Okay.
breast thermography? Yeah.
Yes, 100%. Number one, you need to go to the same place every time. Number two, you need to ask to see when the machine was calibrated. Number three, you want to use the same machine. So if they're not calibrating their machine and they're not willing to show you their certificate, in my opinion, that place should not be in business. It's the same place with the same machine and it needs to have been calibrated because there's too many variations. And
Sure.
if you're using thermography for your only method, it's, if I understand a lot of women don't want to get mammograms, but
I've seen thermography miss breast cancer.
Yeah.
I have seen it miss breast cancer. Now, I've also seen it find abnormalities. I think there are strengths of thermography. And I understand women not wanting to get radiation every single year, every 6 months or whatnot. I understand that too. But that's why typically I'm recommending you have to decide this based on everyone's individual risk factors. But I'm typically recommending women rotate. And now they even have the fast MRI, right? There are just different types of imaging available.
Yeah.
Especially if someone's lower risk, then I'm much more comfortable with breast thermography. But I do agree that at least at some point in a woman's life, she should have other additional imaging.
100%. I agree.
And if she's higher risk, that conversation changes. Yeah.
Yeah. Ultrasound, MRI
Yep.
is very good. And because with my program, I talk to about 60 women a week. And I'd say 80% of them, and I always ask, how is your breast cancer discovered? 80% routine mammogram,
Wow.
80%, because I keep track. That's an amazing statistic.
Yeah, agreed. Okay, so what's the first thing to do if a listener's been diagnosed with breast, or we could go any other form of cancer, but I know this conversation is heavily revolving around breast cancer. What's the first thing they should do?
It's not a medical emergency. Rarely is it a medical emergency. So I would make sure that you really understand what is going on. And because I've had women say, well, I had an abnormal MRI mammogram, and then they called me into the office and they wanted to schedule the biopsy that day. And I went, no, that's not how it works. You need to prepare emotionally for a biopsy. It is not that pleasant. And you want to ask if you can bring a friend with you. There's homeopathic remedies to take to help the healing. You need to get ready psychologically for this big thing. I mean, you're given anesthesia, but there's still pressure. It is a surgery and they tend to minimize it, and it can be traumatic. So you need to gather your team and your friends. I had one woman, she was told it's not a big deal. She drove herself and had to drive herself home. And I said, That's what Uber is for. So there is this thing about women with breast cancer. There's, as a homeopath, breast cancer and cancer in general is one of those diseases that have a certain energy to them. And that's called a miasm in homeopathic medicine. And the miasm of breast cancer is that women do too much for other people and take too little care of themselves. And they think they can do everything themselves. They don't like to ask for help because underneath it, they're a bit of a perfectionist and they think, oh, I'll do it better. So driving yourself to a biopsy, and first of all, it is the responsibility of the place to have told her, this is a procedure, don't drive yourself.
Right.
Is not a good idea, ladies. Always, if your spouse doesn't want to come with you, you get a friend.
Yep. Agreed. Okay. So how does integrative care benefit women who are going through breast cancer treatment? You've already alluded to some of the things that you incorporate with your patients, but how important is integrative care for these patients?
I think having integrative practitioner on your team from the very beginning is one of the smartest things you can do, because medical oncology treats the tumor, but you are more than the tumor, and the side effects of allopathic medical oncology are intense. So what if you can go through it and have less side effects? And for example, if there are, and a lot of oncology doctors say, absolutely do not take any supplements during chemo. So I often have a conversation.
What are your thoughts on that? Yeah, I hear that too. And I'm like, I don't agree with that, but
okay, right. First of all, that's not based on medical science, because there are PubMed articles done on people showing that certain supplements and herbs benefit the person, reducing, increasing the white cell count, keeping them from having anemia, reducing inflammation.
Yes.
So my protocol for women in treatment, most women are on a 3-week cycle. So I want to be respectful of chemotherapy, of course. So 2 or 3 days before the chemo, they stop certain supplements. The day of the chemo, they have their chemo, and then they don't restart for 2 or 3 days afterwards. So within 3 weeks, there's a period of maybe 5 days in which they are abstaining from certain supplements, and therefore you're not going to interfere with the treatment, but you get the benefit. Now, what are the benefits? Reduced anemia. You don't need the Prolia shot because your white and red count are, pretty good. You have more energy. You have less hair loss. You're able to sleep better. There's less inflammation.
Less nausea. Yeah.
Less nausea. So your bowels are moving more regularly. And you feel, in a situation in which there's so much out of control, you feel like, oh, I'm in control because I'm doing my healing smoothie, I'm taking my supplements, and it's taking the best of both worlds, medical oncology and science-based integrative practitioner protocols. So they're getting through treatment is not that difficult. And if you take the best of both worlds, you going for acupuncture, I often find somebody, a local acupuncturist, to see. A lot of the facilities have massages that they offer. Take advantage if your facility has massage and lymphatic drainage. That's a great, go to physical therapy if they offer it. All of that should be covered by your insurance.
Sure. I want to go off on a tangent here and talk about tamoxifen. So I've had a lot of patients, since we've been talking so much about like estrogen receptor positive breast cancer, right, and the Dutch test and whatnot. I've had a lot of patients who have been recommended tamoxifen who don't want to take it because of side effects, right? And sometimes I wonder if they really actually need it. Like, I'm always asking them to ask the oncologist, how much is this actually going to reduce risk of recurrence? And maybe you can speak to that too, because sometimes I think, if the answer's high, okay, maybe yes, consider taking it. But if that percentage is extremely low, you have to weigh the risks of the medication versus the benefits of you taking it. So can you talk about tamoxifen, kind of share who would benefit from this medication, like what it is, how it works, your thoughts on that?
Tamoxifen is really a selective estrogen response modifier, or SERM. And what it does is it gets there, and estrogen, remember how I talked about how it has to have a parking spot? It gets into that spot so the estrogen can't bind to that. Now, what is the problem with tamoxifen? First of all, PubMed research, 40% of women stop taking tamoxifen within the first 2 years due to the severity of side effects. That is standard. That's
Yeah.
been found. Number
Yikes.
one.
Yeah.
That's yikes. Number two, within 14 to 16 months, 30%, if not more, of women will develop something called tamoxifen resistance. That's when it stops working. So the side effects of tamoxifen are, well, and we haven't even started talking about aromatase inhibitors yet, which is a
Yeah, let's go there
category.
next. Yeah.
Sure. But the side effects are tamoxifen is anti-estrogenic on the breasts, but it is pro-estrogenic on the uterus and the endometrium. And there is an increased risk up to 30% of developing endometrial cancer, uterine cancer. So, and tamoxifen, similarly to estrogen, needs to be broken down to be eliminated. And it needs the CYP2D6 enzyme to do that. So, in my opinion, if a woman is given tamoxifen, she should have this enzyme test done
Tested,
first.
absolutely. Yes.
Do the oncologists do that? No. And women who are working with me, I say, go ask your oncologist for this test. And they go, it won't be covered by insurance. That's their standard.
Yeah.
That's their standard phrase. And I say to the
so what? The patient's willing to pay for it. Yeah, I've had patients.
Also
I've recommended this to. Yep.
Yeah, I said to the woman, tell the doctor that you had somebody in your family have this enzyme deficiency and it should be covered by insurance. But so the side effects of tamoxifen, brittle nails, your hair falls out, weight gain, anxiety, depression, because what's happening, you're being put through speedy menopause.
Yeah.
Even if you're older, most women shouldn't be on tamoxifen if they're older. They're usually recommended an aromatase inhibitor. Now, weight gain, depression, anxiety, I mean, and
brain fog.
Well, and they have brain fog because they've been through treatment.
Yeah.
Chemo and radiation. Radiation is a gift that keeps on giving. Now, the thing about tamoxifen is it creates an enormous amount of oxidative stress, enormous amount. And it can create more aggressive breast cancer in the opposite breast, which they'll never tell you about, as does radiation. So,
kind of sounds like you're not a big fan.
well, there are many ways of working with it. A lot of women take it less than their oncologists are recommending. There are ways of telling if the breast cancer was more aggressive or not. I mean, sometimes if you have stage 1 and you had DCIS and they did an onco score and it was very low, I don't know why you would need that. But if you are older and you have breast cancer in your family, first line,
sure,
you need something to block the estrogen. So you don't want to be irresponsible. It's better to take the medication and deal with the side effects and work with the oncologist and an integrative practitioner and maybe take the medication with the oncologist, understanding at less than 7 days a week. But the oncologist has to be on board.
Right.
And then you need to do integrative tools because you want to change the environment in your body. Cancer is a metabolic disease, and you want to make it less hospitable to cell signaling, the cancer calling over to the neighbors, metastasis, all of that. It's a serious decision, and you need to be on board with the whole protocol, changing your lifestyle, how you're eating, and targeted supplements.
Yes. Ooh, speaking of targeted supplements, let's go back to radiation just for a second, then we'll go to aromatase inhibitors. But what are specific supplements to help women going through radiation? Do you have a few that you could mention there? I have an idea of what you might say.
First of all, the radiation oncologist will 100% will always say, do not take any supplements during radiation. Unfortunately, I don't agree with that. It's not based on science. There is a supplement that you should not take during radiation, and that's ionatocotrienols or any form of vitamin E. Absolutely do not take that during radiation. You need to be careful about the level of antioxidants that you're taking during radiation. I have a whole radiation protection and radiation recovery protocol that I share with the women I work with.
In your program,
yeah. So the radiation protection, I'll just give one of them, is you get a little stainless steel thermos and you get organic light miso and you make 2 cups of miso, strong, and you're in the car, and before you walk into radiation, you drink your miso soup, a cup of it, and you go to radiation intermittent fasting. No matter what time, you just don't eat that day, you drink lots of water and green tea. The reason you want to intermittent fast is when you intermittent fast, your cancer cells are going, where's the food? And your healthy cells go into protection mode. So the healthy cells are going to take up less of the radiation and the cancer cells are going to take up more. So then you drink that.
What does the miso soup do? What's the?
It has, it has seaweed in it. So it absorbs some of the radiation.
Oh, because of the iodine.
Yeah.
Okay. Got it.
So you drink a cup before you go in, and then you drink a cup when you come out and you're sitting in your car. And that's very helpful.
Yeah, I haven't heard that one. What about glutamine? Are you a fan of glutamine?
Well, the thing about glutamine is that how it works is it increases cells, makes more cells, right? So I don't want to do that with somebody who's had cancer.
Okay.
Yeah.
I've heard different opinions on it, but that's a good point. Good point.
There are different opinions. There are people say it's fine, and I'm just conservative like that.
Sure.
It's like, why do something else?
Sure.
Charcoal, is a good thing to take during radiation, right? You want to take charcoal substance. You want to make sure that you're moving your bowels. You don't want to be constipated.
Let me go.
You don't want to double boost, because now they're saying just come in for 5 days, you'll be fine.
What do you mean double boost? Sorry.
They're offering the women a stronger dose of radiation for less time.
Oh, and you're saying no.
Okay. Radiation could be every day for 23 or 30 days, whatever is prescribed for you. But now they're saying, you only need to come in for 4 or 5 days, and you're getting a stronger dose. So in my opinion, they haven't been doing that long enough.
Long enough to know. Yep.
And it creates a lot of oxidative stress. And how does oxidative stress show up for you? You're never the same since radiation. You can't get over the brain fog. You have no energy. Like, there's really no energy. You can't get out of bed. You're depressed. We have to get rid of that oxidative stress. It's like, let me give an example, one of my simple examples. Wherever you live, a normal day, you can walk down the street and you're not bumping into people. There's this big event and thousands of people are coming, and you can't walk down the street without bumping into somebody. That's what happens to your cells with oxidative stress. There's no room. They've lost a hydrogen atom and they're bumping into each other, and that creates major inflammation. It doesn't repair itself. You need to change how you're eating, do gentle movement, and take very specific supplements. And annattotocotrienols is the #1 product very powerful for antioxidants, specifically for breast cancer. And the delta and the gamma are the best forms of that, because there's a lot of they've done an enormous amount of research about annattotocotrienols.
Good to know. I've always been taught, at least for my fellowship program, that breast cancer patients, I think this was specifically females, many times have a CoQ10 deficiency. And I don't know if you see that in your patients, but that is a supplement that I use with my breast cancer patients. I'm seeing them after they've gone through all their treatment, usually, right? So antioxidants are safe to use, but otherwise you're kind of saying you cycle them. Well, you were talking about chemo before, but how do you treat them when they're going through radiation? If they're having this huge, oxidative stress burden, are you then afterwards then using the antioxidants?
Yeah.
Okay. So you're kind of doing the same as me. Yeah.
Yes.
Okay.
Right. I help them with nutrition, give them vegetable juices, have them do the miso soup. There's a few supplements that I recommend. One of them is red rice yeast. It's interesting. That's safe to take during radiation. Charcoal is safe to take.
What does red yeast rice do? We use that for lowering cholesterol.
I know.
What does it do?
You know what? I don't quite know, but a colleague of mine recommended it, and I have to look up what it does. I agree with you. What does it do? I have to find out.
But it's protective, you're saying.
It's protective in some way. I don't know what it does. I have to ask him, but
interesting.
This man is very well known and has written a book. He's a good friend of mine. He said, I put everybody on red rice yeast. And I went to ask him, and then he got sidetracked. We were at a conference. So, but I'm going to follow up with that.
I kind of want to know the answer to that. Okay.
I will let you know.
I keep thinking of other questions. So let me go back to tamoxifen. Have you heard of women taking estrogen and tamoxifen together?
I can't imagine.
Okay.
I have.
Yeah. Okay. I'm just curious. I'm
I've
starting to learn a little bit about that, but yeah, I
okay.
didn't know.
So if anybody, I mean, there's this big study that showed, you shouldn't be on a lot of the causes of breast cancer were that women were placed on HRT at higher levels for many, many years. And
Synthetic,
yes,
yeah.
but bioidentical can be, if you have difficult pathways and they haven't been cleared up, it can do the same thing. Now, if you've had breast cancer, that is an indication that your body is not doing its thing properly and healthy with hormones, right? Why would you then, after you had breast cancer, go back on hormones? For me, I mean, I have people who've come in and said, I'm back on hormones. And one woman that I know is taking estrogen because she has severe cognitive decline in her family. And she, but she knows what she's doing. She's checking her Dutch panel and she's monitoring herself, and she's a doctor and an integrative practitioner too. So I respect that. But somebody was given, like you said, estrogen plus tamoxifen. The doctor who gave that to her, I don't even know what to say. I can't even imagine.
I think there's a lot to be learned, or I guess uncover with that. But I've just recently heard about that. I just wanted to ask your opinion if you had.
It's not obviously it's not anything that I would ever recommend.
Yeah, sure. Let's go aromatase inhibitors. So some of these women are recommended aromatase inhibitors. So what are those? How do they work? What are your thoughts?
Well, there's different types of aromatase inhibitors. There's steroids, there's non-steroidal, there's luteinizing hormone, there's agonists, there's a whole bunch of different aromatase inhibitors. So the number one side effect of them is severe osteoporosis. And then when you initially take them, your estrogen is blocked, right? And you go through speedy menopause, and the side effects of that are really difficult because.
So for the listeners, aromatase inhibiting medications block the aromatase enzyme, which converts testosterone to estrogens. So it's blocking that. So just to clarify, but yes, continue.
Yeah. Yes. Thank you for that. I got sidetracked. So you don't have access to your estrogen, and brain fog, fatigue, severe joint pain.
Yep,
and
I hear that a lot. Hot
elbow
flashes,
and knee and unrelenting hot flashes, and your hair is falling out and your nails are brittle, and weight gain around the middle again, painful sex, decreased sex drive, cognitive challenges. It's very severe. And so I've had women already come in with a very documented severe osteoporosis, but they were still put on an AI. And in my opinion, I don't think that's indicated. So first of all, if you're just starting an aromatase inhibitor, I don't think it's a good idea, and speak with your oncologist. You don't want to go from 0 to 7 days right away. The first week you start taking it twice. The second week you take it 3 days. The fourth week you take it 4 days.
Work up,
you work up.
Yep.
Work with your oncologist, number one. Number two, do not suffer in silence. I've had women, this makes me very upset as a feminist. They go into their doctor in 3 months, and it's been torturous for them. And there's this attitude of, oh, well, let's just give you an antidepressant and see if that helps. Don't accept that as a treatment modality. Number two, there's this subtle thing where you're made to feel like you're oversensitive or complaining. Don't accept that. The symptoms that you're having are well documented in research. Any of them are well documented. You're not complaining, you're reporting symptoms. Number 3 or 4, wherever I'm at, lots of women speak with their oncologist. They take a drug holiday, or they get their oncologist to agree. They don't have to take it 7 days a week. But if you're going to do that, you need to then also do the whole protocol. You can't just take a pill and not make the changes and think it's not going to return. We want to reduce your risk.
Yes.
The chance of recurrence is highest within the first 2 years. And even after 5 years and more, you're not necessarily safe. So we want to be due diligence about making these changes that you've incorporated into your life, that you agree that you want to do. It's not somebody telling you to do it. We're adults. Nobody likes to be told what to do. The other thing about aromatase inhibitors is that you need to learn how to manage the symptoms. And as you get to year number 5, there is this test called the breast cancer index. Unfortunately, a lot of oncologists don't use it. The breast cancer index is when they take a sample, the biopsy, the original biopsy is sent to the lab, and then it comes back with statistical significant reporting of if you stay on this medication for the next 4 to 5 years, additional time, how is the risk of recurrence reduced? Everybody should have that test. And it takes, as year 5 comes, you want to be talking to your oncologist. Oh, I'm assuming I'm going to get a breast cancer index test, because they don't always do that. So a lot of them, it's no longer about, well, your tumor was this size, your stage and grade were this, and you had this type of treatment, and therefore I think you should be on it. We can get statistical significant numbers. One oncologist ordered it, and it came back for the woman that she didn't need to be on the aromatase inhibitor anymore. And he said, I don't care what the test says, I think you should stay on it. So for me, that's he goes, I don't believe the test. The breast cancer index is a CLIA lab. It's not an insignificant facility. They know what they're doing. So you need to believe when you do a test from a real lab, you want to honor the results. They're not making it up.
Yeah, good. Thank you for sharing that. Speaking of tests, I think that also is, like you mentioned, what sets functional medicine providers aside. They can offer their patients advanced testing. But I want to talk about circulating tumor cell testing, which I've done on some of my patients. And I saw you had, talked on social media about that. So that I think is just crucial and extremely important. So tell me if that's something that you use with your patients, share with what that is for the listeners.
Right. There's circulating tumor cells and cancer stem cells. So cancer is a metabolic disease. You want to find out what's happening, what are the driving forces in your body, because you've had medical oncology treatment. It treats the tumor. Now, what about the long-term health, right? So I have this whole week, advanced testing, which I'm about to teach tomorrow, week number 4. And it's all about enabling the women to get educated so they can then go into their oncologist and say, well, I would like this test and that test, because usually when the women go in, maybe they get a CBC, comprehensive blood count, to see if they're anemic, what's happening with their white cell. Maybe they get a comprehensive metabolic panel, what's happening with their liver enzymes and their cholesterol. Oh, and I forgot, aromatase inhibitors increase your cholesterol and lead to cardiovascular disease enormously, very dangerously. And so then women are often put on statins. It's a whole nother bag. So back to circulating tumor cells and cancer stem cells. So we want to monitor what's under the hood of your car on a deep level. If your car isn't working well, when you bring it into the mechanic, you don't say, I want you to just look at the right rear tire. You want to open up the hood and figure out what's going on in the engine. So what's happening with your blood sugar management? What's your hemoglobin A1C? How is your leptin? What are your inflammatory markers doing? How are your liver enzymes doing? And all of that. It's not just, are you anemic or not? And then circulating tumor cells are very important because it's a baseline. I think you should get a baseline in about month number 3 after you finished active treatment, and then you're on a protocol.
So this is a blood test for the listeners.
It's a blood test. And it should be covered by your insurance. It doesn't need to be sent any weird lab or anything. And it tells you how many little cells you have floating around your bloodstream that think that they can spread. And that number needs to be low. And if you do it every 6 months, I don't know how often you do it with the women you're doing it with, but I recommend every 6 months. It's an indication how well the protocol is working.
Totally. Yeah.
And so if it was a 3 one time and then goes up to a 7 6 months later, we're heading on a slippery slope. So I would be putting people on, certain protocols for that and taking that very seriously, because you can detect what's happening before it shows up on a mammogram, or before you feel another lump, or before it spreads someplace and you need a PET scan.
Right.
Right.
Excellent. Okay. I know you're probably big on this also, but how does mindset play a part in the success of treatment?
The more I think, well, it's almost, inflammation is the foundation of all disease, right? If you have, think of a farm or a beautiful garden or whatever, and if there's inflammation there, the only thing that's going to grow is not healthy. Mindset is the number two thing after the inflammation, and sometimes it's number one. It's a very difficult within the medical world. If you go in and that's all that you do, it's very difficult not to have anxiety and fear and be afraid. I mean, I think fear of it coming back is one of the things that women talk to me the most. And the second thing is the horrible side effects from tamoxifen or aromatase inhibitors,
Sure.
which are life destroying. So you got to stay in the right mindset. And for me, breast cancer is a disease of the feminine. It's not about attacking or conquering. We're not at war. It's time for women to start having conversations with their body. And hey, breast, even if you've had a mastectomy, what happened that, what was going on that you had to made this little knob in my breast? And I think that it takes a long time to get cancer, right? So it doesn't show up. It's not like a cold you expose to somebody and you get it the next day. So you could have had a trauma 25 years earlier, and then now it can show up as, women have said to me, I know why I had this horrible thing happen to me when I was 16, and now here I have breast cancer. I mean, there is always an emotional component to disease, and there's always physiological stress, environmental aspects to disease. So understanding what's going on in your body from an emotional perspective and staying connected to that is a very important aspect of recovering. And, if you've gone through surgery and your body is different now, you've had a mastectomy or you've decided not to have reconstruction, it impacts, we're used to looking at ourselves in the mirror and we see a certain thing. And if it's different here, it can impact how you feel about yourself. I've had women say to me, this is very common, I don't feel like a woman anymore. And then there's marital problems. There's a huge divorce rate among women. 50% of women after breast cancer, their partners leave them.
Wow, I didn't know that. That's sad.
It says it's a lot of testament about the strength of the marriage. There's lack of intimacy. I created a Recovering Intimacy After Breast Cancer mini summit and brought together several of our colleagues to talk in that. And what I want to say I have this concept of elephant in the room conversations, which I love, because nobody wants to talk about this stuff. But I think if an elephant is in the room, we got to let the elephant out back in nature, and we got to get the room back. Not having intimacy with your partner is one of those elephant in the room conversations. And it's really, first of all, I guarantee you that your partner, whether it's a man or a woman, does not know how to start talking to you about this topic. Because you're afraid that the first thing out of their mouth, you're going to get upset and start yelling or crying. There's no education about this. They don't know what you want. They don't know what you don't want. You might not know what you want. Many women realize they don't want to be naked anymore. They get a little camisole that they wear. They don't want their breast touch. You need to communicate.
Sure.
And as we get older, intimacy is different than it is in the movies when we're in our 20s. So we have this perspective of intimacy that we see from a movie. Do you know how many people worked on that scene of intimacy that you watch in a movie? There are experts in intimacy management and positioning and lighting that we watch in a movie. And that's what we think intimacy is. That is not reality.
Right.
You need time to get into the mood. You maybe intimacy is, just reading to each other or rubbing each other's feet. It's not what it used to be, but it doesn't mean that it's not important. And talking and figuring out what you both want is really the beginning of moving forward in recovery.
Yeah, that was beautiful. Thanks for sharing that. I when you said you put together a summit of, colleagues talking about recovery from breast cancer, that made me want to make a little plug here for a couple other things I didn't intend on
Great.
mentioning on this episode, but we do use a lot of testosterone replacement therapy in breast cancer patients. It can be just very helpful for them, on or off an aromatase inhibitor. But testosterone is great at building back bones. So many of these women need that. For many women, a little bit of the testosterone actually does convert over to estrogen, just enough that it helps the vaginal dryness. That testosterone is going to also protect their brain and not just their bones, but their heart. Great
Mhm.
for mood, great for libido, energy. So I don't know your thoughts on that, but I'm a big fan of testosterone replacement therapy. And there have been several trials showing it is very safe in breast cancer patients. Um,
Good.
to use testosterone. And we also use vaginal estriol. And I don't know,
Yeah.
if you're a fan of that, but that's something, and or the Jolva cream. And maybe you talked to Dr. Anna Quebec about that, but I had her on the show a couple years ago. She created it's a non-estrogen, more of a DHEA based vaginal cream. So for women who really don't want vaginal estrogen, they could use the Jolva cream, but I'm totally fine giving vaginal estriol. It's not going to convert to anything else. I feel like they're going to have local absorption, not a lot of systemic absorption there. So I'm very comfortable prescribing vaginal estriol to these women, and that can be a big game changer as well. So I just wanted to put in a little plug for those two things, but feel free to, share your opinion on those as well.
I've spoken to a lot of medical oncogynecologists, gynecological oncologists
Oncologist.
about
Yeah.
that.
Yeah.
And there is two camps. One is that, as you said, it's fine. And other women, other doctors feel that a bit of it is absorbed. And I like
The
the
vaginal.
tablets.
Sure.
Yeah, I
Sure.
like the tablets as opposed to the cream, which is all gooky, and those little
Yeah.
tablets are great. Um, my if you've had very aggressive breast cancer, I don't think you should do that, because
Sure.
there is a small percentage of it being absorbed into the bloodstream. If you're doing a healthy protocol and you're doing everything else, and putting in a little tablet once or twice a week is enabling you to have intimacy with your
Yep.
partner, I think it's fine. But I always recommend that the woman speak to their, get an opinion with the
Of course. Yeah.
oncological gynecologist first, not their
Yep.
regular oncologist, and it really depends on the nature of the breast cancer that the woman had. But I think that maintain, the testosterone and Dr. Anna Quebeca, who's a colleague of ours, that is, and a little bit of estradiol on a person by person basis, depending
Yep.
on what
Yep.
kind of breast cancer you had, is appropriate.
Always assessing risk versus benefits, but also quality of life too.
Yeah.
Some of these women
Yeah.
are like, give me, I need the vaginal estriol. Like
If you're
that's their,
36 years
yeah,
old and you've
yeah,
had breast
yeah,
cancer, I mean, that is,
yeah,
it's different if you're 36 versus 56
yep. Or
or
76
six,
or
or
yeah, yeah,
yeah, right.
yep, yep, agreed. Okay. Let's go back to, let's see, in a time of uncertainty, what do you think is one element women can easily control to reduce the risk of recurrence, on the topic of recurrence here?
I think mindset is really at the top of that list.
Okay. All right. Then I want to circle back around to your cooking days. I have to, sorry, but that past episode with you was great on cooking. So
Yeah, that's
can
fine.
can you share some, just based, I know you're a pastry chef, but share some of your favorite, maybe healthy how should I say that? Breast
Breast
health
health.
recipes or foods
Well, I
You
used to
could
be
go
a
that route.
chef and a pastry chef, so
Okay, okay.
I think there's fresh vegetables are a big, and eating with the seasons, I have to say. Salads now and we're having this fall come on, but in the summer, lots of fresh vegetables and salads with really healthy olive oil and lemon juice is my favorite. I use butter. If you're steaming vegetables, organic butter, there's nothing the matter with it. Lots of butter and salt and pepper, and you have steamed beautiful, delicious vegetables. Pastry baking is a little bit more complicated. I make recipes, maybe some of them don't have any sugar in them. I have gluten-free waffle recipe that I think it has 1 tablespoon of maple syrup sugar or coconut sugar in the whole thing. It's not that sweet. And I have a date nut bread that has zero. You don't need sugar if you have
Yeah,
dates.
yeah, that sounds good.
Yeah, and if you sign up, if we have a free gift here, but once you're on my email list, I do send out like my healthy holiday baking. I send that out to everyone. You'll get that, and that's going to happen this year too.
Perfect. Well, yes. Well, let's go there. So tell us where listeners can find you. You kind of alluded to your program. So tell me what you have going right now. And
So
then the free gift as well.
yes. Well, let's do the free gift, which is my healing smoothie recipe. Dr. Stephanie will be posting that, and you'll be able to put in your email, and that's sent to you. And that's a proprietary combination of a pea isolate protein powder or a whey, and a couple of other supplements that are very healthy for you. And it's not just for cancer; you can use that for anything.
Sure.
It's really great. And the other, to find me, I have a 6-week live coaching program where I take women through Empowered Against Recurrence. And the easiest way to get on my email list for that is to use the contact me page on my clinical website, carollourie.com. And it's Lourie is my last name. It's one word. And
Sure.
there's a contact me. Just say, I want to get information about your Empowered Against Recurrence program. And I'll be doing lots during the month of October, lots of free master classes about that. So
good timing.
You'll be able to, good timing.
Perfect. All right. Last question. What's your top longevity tip? I don't remember what you said last time. So
I don't remember either, but I would have to say movement.
Specifically, just get out and get moving, or
yeah. I mean, you have to find 2 things that you like to do 5 or 6 days a week that get you moving for up to 40 minutes. And so if you ask me to go swimming or ride a bike, that would never happen. But I have my power walking. And when I say power walking, I'm up there looking ridiculous like this. And sometimes I have weights with my vest on, my weighted vest.
Yeah.
And I also like to lift weights. So you need to make time in your schedule. If you're a couch potato, you're going to, and eating the standard American diet, you are going to get some disease eventually. And you don't have to be old and have a disease. It's not necessary. I'm old and I don't have any diseases, and I intend to keep it that way.
Yes.
And my daughter said to me, Mom, my mother, her granny, was in a wheelchair and she said, you don't want to be in a wheelchair like Granny. And I said, heck no. And I was out of shape. I started walking, not power walking, and I live in a hilly neighborhood, 5 minutes out and 5 minutes back. And that was several years ago. Now I'm, an hour out and 45 minutes back because it's downhill. And I do that very religiously. So it's never too late to start. And when you first start, you can start with 5 minutes. You don't need to start, with an hour. You work up. And I've lost weight and, I'm muscles and I'm, older, and I'm not going to be in a wheelchair. You don't need to be in your 90s and be in a wheelchair.
Agreed. Well said. I intend to do the same.
Right.
So, thank you so much today for coming on the show and just sharing what we can do to reduce estrogen dominance, but also for being such a resource for those with breast cancer. So I encourage listeners to connect with you. This is great timing. This will launch in September before October. So this is great. Thanks again.
Thank you for having me. Take care, everyone.